Welcome back, one and all. Today we're evaluating interruption properties. In the previous lesson, we discussed the three properties of interruptions and what they are. To refresh, they were first, interruption urgency, which is the importance of the interrupting task, the cost of interruption, which is the importance of the primary task and the consequences of interrupting the primary task, and we had relatedness, which is the degree to which the primary and interrupting tasks can be multitasked. So the ultimate goal of identifying these properties is to choose the optimal interruption management strategy, which will allow us to handle interruptions properly and with the minimal risk of clinical error. In this lesson, we're going to learn about how to determine each of these properties. So first up is how to determine interruption urgency. There are three main factors that you need to determine urgency. And these are task stakes, task timeliness, and task proficiency. So the stakes refers to what happens if the interrupting task goes unattended or incomplete. What are the consequences of letting this task lie? How severe will the consequences be if nothing is done? The timeliness refers to the amount of time you have before the interrupting task has to be attended to. Can this task wait? If so, how long can it wait? What's the amount of time before action is required? That is the key determinant of timeliness. So then we have task proficiency, and that refers to both your proficiency and the abilities of those around you. Is this task easily done by anyone? Does it require a specific skill set? Do you have the skill set that's required to handle the interrupting task optimally? Do others around you have the required skill set? And are they more highly qualified than you are? All of these factors are in determining proficiency. So let's apply this to the scenario from the last video. The nurse is documenting a routine patient assessment, but is called to the desk by the manager to discuss scheduling. And remember, we're looking at the interrupting task when we talk about urgency. The stakes are that your scheduling won't get done properly and your boss will be irritated with you if you keep putting this off. As for your timeliness, this task can definitely wait. It's most likely it needs to be done as soon as you can, but it's not a needs to do right now sort of deal, right? So when it comes to proficiency, obviously you're proficient in talking about your schedule. That said, you are the only one capable of talking about your schedule. So it's not something that just anybody can do. Taken together, the stakes, timeliness, and proficiency comprise the total urgency of the interrupting task. Each one can be thought about in terms of these graphs. So for stakes, as stakes increase, urgency increases, resulting in a positive correlation between the two. As timeliness increases, the amount of time that the task can wait to perform, as that increases, urgency decreases, resulting in a negative relationship. And as for task proficiency, if you are proficient in the interrupting task, then the task urgency will increase as the number of other people around you who are also proficient decreases, resulting in a negative relationship. So if there's less people capable of doing it, then we have more urgency. We make the assumption here that you're going to be proficient in the interrupting task because if you aren't proficient in the interrupting task, then it's immediately obvious that this task should just be given to somebody else and you should not be doing it. This consideration it's absolutely meaningless if you are not capable of performing the interrupting task in the first place. If you're not capable of doing it in the first place, then we won't even be thinking about this. You'll just be giving it to somebody else. So now let's take a look about the factors that determine the cost of interruption. This property is the most complex and it requires the most consideration to determine. The most important determinant of cost of interruption is the primary task importance. Now this is simply assessing urgency again, but this time it's for the primary task instead of the interrupting task. So while this is a good start to assessing cost, it doesn't reveal the entire picture. To gain a full understanding, you need to know and consider the following. The rules of interruption cost. There are three. We have the rule of interruption timing, the rule of interruption length, and the rule of interruption load. All right, so the rule of interruption timing states that if the primary task is interrupted in the middle, you're more likely to make an error than if you interrupt that same task near the beginning or near the end of its execution. So therefore, switching away from a primary task in the middle of execution is going to result in a higher cost of interruption than switching at either extreme. Interrupting the primary task in the middle, based on this rule, should generally be avoided. So now we have the rule of interruption length, and that one states that the longer interruptions increase the risk of task error. This rule requires you to be aware of a thing called primary task pause time, which is just the total amount of time that the primary task will be paused for, right? So the longer the pause time, the more time that an interrupting task is going to take to complete, generally, and the higher the risk of error. Right? So the rule of interruption length then also encompasses another concept that we call chained interruptions. So chained interruptions can also be thought of as consecutive interruptions, and these are interruptions that appear before a pre-existing interrupting task has been completed. To better understand this concept, let's look here at a visual example. So in a normal interruption, you're doing your primary task when an interrupting task is presented somewhere in the middle here. Assuming you actually choose to interrupt it, the primary task is now paused, and you are now conducting the interrupting task. While conducting the interrupting task, let's say another interruption is presented. This one is going to be known as a chained interrupting task. So as you can see, the more interruptions that you choose to accept, the longer the primary task pause time becomes and the higher the risk for error grows. In the case of chained interruptions, the increase in risk that occurs here is not linear as you may expect, and nor is it just contained to the primary task. This is where what we call the rule of chained interruptions comes in. The more times you allow yourself to be interrupted, the higher the cost of each interruption will be, right? So in fact, error risk increases exponentially with each additional interruption you take on for the primary task and for all interrupting tasks. Chained interruptions should therefore be completely avoided unless they are absolutely necessary. Try not to be interrupted if you've already been interrupted. Finish what you're doing at all costs. So the final rule governing the cost of interruption here is going to be the rule of interruption load. The rule of interruption load states that the higher the cognitive load or the mental strain that each task involves, the higher the risk of error, right? So in an actual interruption, if the mental effort involved to perform both the primary task and the interrupting task is low, the cost of interruption is going to be less than if one or both of those tasks required a high amount of cognitive effort. So bringing back our example, let's put this in practice. We have nurses documenting a routine patient assessment, but then gets called to the desk by the manager to discuss scheduling, right? So we can now take a closer look here at the cost of interruption. The primary task importance here is probably about a 4 out of 10. So it's definitely an important task, but many things are decidedly more important than this, right? More important than documenting a routine patient assessment. I can probably come back to this. It's not a terribly big deal, but also there is some risk of being interrupted here. For timing, we can assume by this premise that the nurse is probably in the middle of the documentation task, and increasing the risk for error more than if the interruption had occurred near the beginning or the end of the task. So it does depend where you are in here. For now, we're just going to assume that they're in the middle. The length of the interrupting task is significant also. Scheduling talks could take up to an hour. So that's a pretty large primary task pause time we're talking about here. And finally, the cognitive load of both tasks is relatively low. So even so, with the other factors hiking it up, our cost of interruption ends up actually being higher than the urgency of the interrupting task here. So the importance of the primary task and the 4 rules of interruption cost can be most easily understood by thinking about them in these charts. So as seen here, the primary task importance can have a positive relationship with the cost of interruption. The more urgent the primary task, the higher the consequences of interrupting it. Then we have the rule of interruption timing, and that can be thought of as kind of a bell curve. As primary task execution approaches the middle of the process, the risk for error should this task be interrupted will increase. However, the risk, and therefore the cost of interruption also, is smaller at the beginning and at the end of primary task execution, resulting in this bell that we see. And like primary task importance, the rule of interruption length suggests a straight-up positive relationship between primary task pause time and the cause of interruption. As the amount of pause time increases, the amount of time that we are spending in between being interrupted and getting back to the primary task, the cost of interruption is going to increase also. The rule of interruption load proposes a positive relationship between total cognitive load and the cost of interruption. This graph can be used to judge the severity of the effective cognitive load with the primary task on one axis and the interrupting task on another, with both tasks ranging from low to high mental effort. So the farther up and to the right that we can plot a point on this graph, the higher the cost of interruption. And although it's not formally one of the three rules of cost, the rule of chained interruptions declares a positive relationship between the number of interrupting tasks in play and the cost of interruption. So as the number of chained interruptions increases, the cost of them being interrupted increases exponentially. So to put a number on it, primary task importance probably comprises about 40% of the cost of interruption. So it is the most important factor, but it doesn't get all of it. The three rules, timing, length, and load, each account for about 20%. So this means that even if your primary task is slightly less urgent than the interrupting task, let's say I have an urgency of 5 and then a primary task importance of 4, the actual total cost of interruption may end up being greater than that interruption urgency. So knowing that this is possible and knowing how to identify when this happens is going to save you from making a lot of unnecessary and avoidable errors in your clinical practice. Because most people only consider the primary task importance, they don't consider these other factors. Finally, we have the factors that determine the third property, relatedness. There are three rules of task relatedness to keep in mind. We have the rule of task effort, the rule of task modality, and the rule of proximity. So the rule of task effort indicates that the higher the mental effort of both tasks, the greater the difficulty in performing both simultaneously. Essentially, it is much harder to multitask two difficult tasks than two easy tasks. The rule of task modality states that the more similar the interrupting task modality is to the primary task modality, the more disruptive it is. By modality, I'm referring to which of the 5 senses and cognitive functions that are being used to conduct the task at hand. So, for example, it's a simple task to ask a patient questions about their health habits while preparing their IV medication because none of the modalities involved in either task conflict with each other. However, it's far more difficult to answer a phone call while entering patient chart information due to a conflict in the language modality. And it's nearly impossible to ask questions to a patient for their chart while taking a phone call because both tasks require listening and speaking, right? So the rule of proximity states that interruptions that require a change in physical location are more disruptive than interruptions that are nearby. Unlike cognitive load and modality, where you want to avoid similar high load or modalities, proximity similarity is a very, very good thing. Essentially, the farther you have to travel to attend to the interrupting task, the less related the two tasks are. This rule requires the most common sense. It is impossible to be in two places at once. So the rule of proximity will often be your first question when thinking about multitasking. It's a yes or no question here. Are the tasks close enough? Yes or no? Right? So let's look at the relatedness of our example now. Both of these tasks are medium effort tasks. They both require like a decent amount of focus, but they aren't the hardest thing in the world. So according to task effort, doing them together is going to introduce a bit more cognitive strain than we would like, but it's not crazy levels of cognitive strain. So looking at task modalities, speaking to the manager and looking at the schedule require many of the same mental resources and physical actions like reading, storage of information, language, and so the modalities are just not compatible. And not to mention the rule of proximity. These tasks are absolutely nowhere near each other. So while it's obvious that you can't do these tasks at the same time, it's still useful for scenarios where this might be a little less obvious, right? So the relationships between the rules and relatedness would be graphed in the following ways. The rule of interruption load is the higher that the total cognitive load is imposed by the interruption, the lower the relatedness becomes, resulting in a negative correlation here. The rule of task modality states that the more closely related the task modalities of the primary and the interrupting tasks are to each other, the lower the interruption relatedness becomes. This results in a negative correlation between modality and relatedness. The rule of proximity, the greater the distance between the primary and the interrupting task, the lower interruption relatedness becomes, which results in a negative correlation. Every single one of these is a negative correlation when it comes to relatedness. Now, what's important here is that in order to multitask, they have to be low cognitive demand, the modalities need to be different, and they need to be in the same room in order to multitask the interrupting task and the primary task. If these things are not true, they cannot be multitasked. So, to sum up the parts of each interruption property, we have interruption urgency, which is the importance of the interrupting task. That requires the stakes, the task timeliness, and the task proficiency. So if it's high stakes, there's little time to perform it, and there's no one else who can possibly perform the interrupting task, then the urgency is very, very high. Okay? So then we have the cost of interruption. The cost of interruption is the importance of the primary task and the consequences of interrupting the primary task. For this, we have to consider the importance of the primary task and the 3 rules of cost. So the rules are the rule of interruption timing, the rule of interruption length, and the rule of interruption load. Basically, if the primary task is important, if you're in the middle of its execution, and the tasks are both difficult, then the cost of interruption is going to be high. Okay? Opposite of all those things, going to be low. Then we have relatedness. This is how closely related the primary and the interrupting tasks are to each other. For this, we have the rule of task load, the rule of task modality, and the rule of proximity. So if both tasks that you're considering multitasking are high load, they're similar modalities, so they take up the same cognitive resources, and they're far away, then it is not good for multitasking. You cannot multitask these kinds of tasks. But if it's low load, the modalities are very, very different, and they're very, very close to each other, then you can multitask it. So of course, when dealing with interruptions in the healthcare environment, the goal is to be able to make a decision very quickly. You're not expected to stop everything you're doing in order to calculate the precise numbers and the relationships between each of these properties every single time that you face an interruption. That'd be a little ridiculous. However, by understanding the properties of the interruptions, the reasoning behind them, how well they're identified, you will, with practice, be able to make accurate judgments about any interruption that you may face and choose the correct plan of action. So now that you have the knowledge necessary to identify interruption properties, the next lesson is going to address how you can use those properties to select the most effective strategy for interruption management. See you there.